Okay, so with this, we're going to start looking at the coronary arteries or the coronary artery anatomy. And there's two kind of parts that go with this. The first part is what we call the coronary artery tree. And that's, we're going to go over just kind of the nomenclature and how these are named. And then finally is going to be kind of locating them on the heart and how we do our angiographic views. So for starters with this, we're just going to go over the nomenclature and identifying these arteries and the branches that can potentially come off of them, so that this way when we get into the angiographic views, you're more able to easily identify those and kind of know what we're talking about when we're talking about, say, like a diag or an acute marginal, obtuse marginal. And when we are talking about coronary arteries, we're talking about those arteries that are feeding that oxygenated blood. They're going to come off the sinus of Valsalva, they're off of that aorta, and they're going to bring that blood here down, around, and into our heart, and that's what's going to actually feed our heart. So as we get started with the anatomy, we're going to talk first about the origin of those coronary arteries, and that's coming from our sinuses of Valsalva, also called the coronary sinuses, even though it's not technically a proper verbiage, but that's what you'll hear it called a lot of the times. If we look under angiography, okay, at the start of the aorta, we're going to see these two bulbs, and they give rise to our aorta, right? So if right here was our ascending aorta, okay, then we have our aortic arch right here. This area here is our sinus of Valsalva, okay? And that's where we have our three kind of bulbs or three sinuses. And right here is our aortic valve. So if we were to cross-section this way, okay, our aortic valve has three leaflets. Okay, so it kind of looks like a peace sign like this. And each of these leaflets has one of these bulbs here. Okay, so we'll have one come up like this, one like this, and one like this. So this one in the back here is called our posterior. Okay, we have the one up over here which aligns to the left. So this is our left sinus, and then we have our right. So what you'll generally hear is you're going to hear the right coronary sinus. Okay, that's going to be this one, the left coronary sinus, and then the posterior non-coronary sinus. And what we're talking about when we hear coronary, non-coronary, is because this left side is going to give rise to our left coronary system. The right side is going to give rise to our right coronary artery system. And the posterior shouldn't have any arteries coming off of it. It can happen. That's something called an anomalous artery. But generally speaking, it should just be the left and right. So when we start talking about the coronary artery anatomy, we're going to break it down into two trees. Okay, and we call them trees because they actually kind of literally look like trees. We have our main trunk, and from that trunk we have our branches that come off of it. We're going to start with the right coronary tree, just because one, I think it's a little bit easier to understand, and two, there's a bunch of arteries that could come off of the right or the left. However, about 80% of the time, majority of these are going to come off of the right. So if you're looking for them there and you don't see them, and then you see it over on the left, that'll make a bit more sense. But the vast majority of the time, it lining up like this. So for starters, we're going to draw this whole tree also upside down, kind of. Instead of it growing up, it's going to grow down, just because that's how the blood flows through the heart, and it'll make a bit more sense when we get into our angiographic views. Okay. So when we start, we have our bulb, okay, or that coronary sinus that we talked about. So right here is going to be, we're going to label it as the right coronary sinus, or the right sinus of Valsalva. And from here, we're going to have our first branch, okay? And this very first branch, and really this whole major side and artery, is going to be our right coronary artery. Right coronary artery. Or the RCA. Okay. Now, also at this junction, we have our first branch. And this branch may happen up over here to the side, or sometimes it even comes off of the sinus up over here. So it can happen at either of these spots. And this branch is called the conus. The conus is one of the more important ones you're going to have to learn very quickly, especially if you're in the cath lab or anything, just because injecting the conus can lead to VFib or ventricular tachycardia. The conus gives the blood supply for possibly the vagus nerve and it also gives all the blood supply to the right ventricular outflow tract. So if we were to take that blood supply away by injecting contrast, that's what can, make the heart go haywire, and that's where we get our VFib or VT. We'll go into checking that later when we get into angiographic views and when you're injecting and everything. But the important thing is to always make sure you're identifying the conus artery location before we get to a full injection. As we move on, okay, we're going to come down here. We're going to go to our next branch and come off the side here. And this is one of those branches I was talking about where it can be on either side, but majority of the time it's going to be on this right side, which is the SA nodal artery. Okay, so the sinoatrial nodal artery. And that's going to give the blood supply to our SA node. The next one that goes down from that, again, this one can also happen on both sides, is going to be our AV nodal artery. Okay, so both of these two here can be on either side. Again, about 80% of the time, they're on the right. The next one that's going to go down, and you'll notice if this is there, because it'll be really, really long, okay, is called our acute marginal. So this one particularly, it goes to the apex of the right ventricle, and it's kind of like the LAD we'll talk about in a bit, but it's going to be noticed because it's very, very long and it'll be kind of straight. Okay. Other branches that might happen as we're going down here, okay, is we can have right ventricular, okay, or RV branches. And these aren't always necessarily there, or they may be very small. Eventually, though, we're going to get to a major bifurcation. Okay. This is where things are going to kind of go in two directions. And I'm going to draw this way just so we can have our extra branches up over here. Okay. So at this bifurcation, we go to two major branches. So we'll have the one branch, okay, and it's going to be noted because it's going to have what are called septal perforators. And we're going to see these guys, they're like little fingers, right? So you see here we have all these branches, they're kind of big. These are like little fingers that penetrate down. So this one here is called our posterior descending artery. Posterior descending artery. Or the PDA. So this artery is going to be the opposite of the left anterior descending artery. And we have to imagine is that there's kind of like a cusp, right? If we have our left and right ventricle and we've divided them in half right here, okay, the LAD would be sitting going down, say, this way, and the PDA is directly opposite of it. Or if we cut the heart down the other way with the PDA up over here on this outside of the heart, the LAD would be going this way. These septal perforators are going through that ventricular septum, and they meet like this, okay? So this is the posterior descending artery. And again, the easiest way to notice it, if it is on this side, is you're going to see septal perforators. The next branches that we can have past that posterior descending branch, okay, is going to be our posterior lateral, okay? Posterior laterals, or PL branches. So at this point, when we've gotten to this bifurcation right here, just to notice whenever we get later on into our anatomy, is everything's happening on the back side of the heart. Thus, the reason it's called a posterior descending artery, and we have our posterior laterals, okay, or PLs. Before this branch, we should still be up along the side to the medial or kind of inside aspect of the heart, and that's where we're still getting those RV branches, okay? So the PDA is also a big one. Just like we mentioned, the SA nodal artery and the AV nodal artery may come off of the left. The posterior descending artery may also come off of the left. Okay, I want to note that the PDA, roughly 80% of the time, okay, comes off the right coronary artery. The reason this kind of is a bit more important, especially as far as we're talking about nomenclature, is that whichever side gives rise to the PDA, whether it's the right or the left, is what will be called the dominant side. So if you hear right dominant, they're saying that the PDA is coming off of the RCA. If you hear left dominant, they're talking about the PDA coming off of the left coronary system. So now we'll start moving into the left. So as we get into the left can be a little bit more complicated. I'm going to draw some things over to the side at the end here to helpfully break this all down a bit more. So on the left, the very first one, the biggest one that's going to come off here, again, we have our left coronary sinus up here. Okay, so we have this very, very big branch. And what it's going to do is it's going to go into two other big branches. Okay. So this is our main trunk. And this main trunk, this very first part, is the left main coronary artery. Left main, or you'll just see LM. Okay. And that's that just trunk before we get to the bifurcation. When we get to the bifurcation, we have two branches, which is going to be our left circumflex. And this may be denoted by either LCX, or you may see just LC. It kind of depends on the person and how they write it down. I generally use the LCX. Or you may also see LCA is another one, a left circumflex artery, even though LCA more properly should just be the left coronary artery system. And then the other branch over here to the other side is going to be the left anterior descending. Or LAD. Now, one thing to note here is that there is also the possibility of another branch arising directly in between these two. Okay, so we could have three branches here. This is a bit more rare. It's, I think, like 20 or less than 20% of the time. I'm going to write that one over to the side, and that is the ramus branch. Okay, so we have the left main, the left circumflex, LAD, and then the possible branch over here is our ramus. Okay. So the way we're going to differentiate these two branches, because it can be kind of difficult, especially when you're starting off, is the same way we identified that PDA. Okay, so remember when we broke that the ventricles in half and we looked at the septum, the PDA and the LAD have septal perforators, right? So it's got these little fingers coming down like this that go into that ventricular septum. So these here are our septals. And they can be kind of big sometimes, especially these first couple septals can almost be the same size as the other branches coming off of the heart. Okay. So the way we look for the LAD is we're going to look for these septal perforators coming off of it. And you're also going to look for the really, really long one that's going down. It's going to go all the way to the apex of the heart. Okay, so this is going to be a super, super long branch, and it can have a couple things coming off of it as well. The circumflex is going to be more curved rather than straight, depending on the view that we're using, and it's not going to be as long. Now, both of these have their own branches that can come off of them like so. So with the LAD, these branches that come off are called our diagonal branches. Okay. Diagonal branches. And these are denoted in number. Okay, and it starts from the most proximal portion here. So this one here would be diagonal 1 or D1. This would be D2, D3, vice versa going down. Okay. Generally speaking, also, the LAD is going to be broken up into a proximal, mid, or distal segment. The first kind of part of that is the proximal part, and that's going to be before the first diag. Between the first diag and, depending on who you ask, either the last diag or the next third of it would be your mid LAD, and anything else past that would be the distal LAD. And the other side, going back to the left circumflex, okay, we have its branches that can come off like so. And those are going to be obtuse marginal branches, also called OMs. OM. And they do the same thing. So we have D1, D2, D3. This one here, OM1, OM2, vice versa the whole way down. Now, at some point, also what we can have sometime around here is we can have the other bifurcation. And we'll have one that comes around, right? And it's going to have septal perforators as it kind of wraps around the heart and goes opposite the LAD. And hopefully you remember what this one was called. Okay, so this is the posterior descending branch, or PDA. Now remember, just like we said last time, okay, about 80% of the time it's coming off the right, so roughly 20% of the time it's coming off of the left. Majority of the time comes off the right, sometimes comes off the left. So the way we're going to kind of like match these up, just to remember our general how each one is going to be labeled. So for the LAD, okay, I want you to think diag, okay, the left circumflex, OM. The RCA is going to have our PL, conus, and often the PDA. I'll do a little start here, and then a start here. Generally speaking, comes off the RCA, but the main branch we're going to worry about with the RCA is going to be the PDA. Okay, and the main ones we're going to worry about with these two are going to be those. And from the left main, just to add this up here, we go to the LAD, circ, possibly ramus. So that's gone over our coronary artery tree. Okay, so going off to this first image that we started everything off on, just to do a quick recap and see where you're at. Okay, if we look at this image, we see we have our aorta here, we have our sinus of Valsalva. So I want you to think of coming off of this right sinus of Valsalva, okay, what branch this is. That should be our right coronary artery. What about on this left side? Okay, so see this comes down, it comes to a branch. This is the left main coronary artery. Once we get to that branch, it goes into two spots. Okay, so we have one that's going straight down to our apex and has these little guys here. Those little guys, remember, are called the septals, which means that this one here is the LAD, and the other branch is the left circumflex. Knowing this also with our RCA, the other one we're going to identify here is this long one also going to the apex for the right ventricle. That's our acute marginal. Wrapping up and around, we see we have one that goes directly opposite the LAD, and we would see tiny little septals coming off of this. That is the PDA. The circumflex has its branches coming off like this. Those are OMs. The LAD has its branches, diags. And like that, now you're able to identify all these branches and everything. Now we'll go into this a lot more in depth when we start doing the 3D model and we start going to angiographic views.